BEONTV UK, for the community, by the community. www.beontvuk.com. BEONTV UK, for the community, by the community. www.beontvuk.com.
Anam Choudhury, and welcome to Community Research Program. We are here to talk about understanding patient data today. I have with us three guests from different organizations. I'll introduce to the guest in a bit. Firstly, about the program, community research is very important for our communities because we want to address a number of issues that within the communities, and we want to get the communities involved in all areas of concern, and also work with our communities to find solutions to the problems that we have within our communities. Without the research, it's very hard to understand the issues that we are going through, and also without the research, we can't really find the right solutions for our communities. So that's why we've invited three guests today to talk about understanding patient data, because patient data is very important. Patient data is used to analyze the needs for our community and also find solutions to a number of problems. So let me introduce to you first Kenny Imafidon. He is the Managing Director of Clearview Limited. So welcome, Kenny, to the program. We also have Grace Annan, who is a program advisor for the Wellcome Trust. Grace, welcome to the show. And we have Rebecca Asher, who is a strategy and engagement manager for the Wellcome Trust. Welcome to you all.
Hi.
Thank you for coming and joining us today. Hope you had a good journey. So coming here.
Yeah, no, it was all very smooth. Thanks very much. I'm really delighted to be here.
Lovely. Thank you very much. Thank you. Welcome. So before we go into the topic, I just wanted to ask you, Kenny, tell us about your organisation, Clearview Limited. Give us some background to the organisation and to yourself as well, because I've looked into your organisation and it's very inspiring. As a young man, you started this research institution, and it's going very well. So tell us more about yourself as well as your organisation.
Thank you. And so in terms of myself, so I'm the Managing Director at Clearview Research. So a lot of the work that we do is very much focused on, as the name suggests, doing research as well as doing evaluation and engagement projects in the community. So that's how we've come to know you. So a lot of our projects involves us working with organisations who want to make a difference, want to make a real impact in communities, and we help them to basically provide them with community-orientated as well as culturally informed insights, so they actually understand the cultural nuances. So a lot of the different people we worked with are like the NHS, Macmillan, UNICEF, and the government as well, and just different organisations who basically want to make a difference and have to work with people. So that's a lot to do with the work that we're doing, and obviously the core of our work is equity and also co-creation. So actually making sure that people who are most affected by the topic that we're looking at actually involved in informing what that research looks like, and making sure those people they understand that they're valued and that they understand that actually their input will help to make a difference in terms of what they're doing. Because not enough people get involved in community research, as you know, and for us it's about making sure that's exciting and also a worthwhile experience for people.
Okay, so do you find a good response from the community?
Yeah, we do, and I think a lot of that has to do with just what I mentioned earlier about in terms of just making sure that we ensure that people are valued and that actually they're being paid for their time, first and foremost. That also when we're working with them, that it's very clear what is required from them as well. There's nothing there's nothing shadowy about it. So even when you talked about like data and everything else, people are very clear on what the ask is and what will happen as a result of their participation. And I think a lot of times people just want that honesty and also the respect for their time. And so for us, those are key things. And also just the fact that you actually can play a part in making a difference, which for many people is important.
Brilliant, exciting stuff. Grace, you are the program advisor for the Wellcome Trust. Yeah, so tell us about the trust itself. What do you do in the organisation?
Yeah, sure. So my role is really around kind of communications and learning. And the programme I want to talk about today is a really specific one called Understanding Patient Data, which is based at the Wellcome Trust. And that's the programme that we're working, it's through that programme we're working with Kenny and Clearview. And the focus of that specific programme is really about trying to make the way that patient data or health data is used a bit more visible and a bit more understandable for people. You know, it's not a very exciting you know, topic or term. You know, sometimes people say, oh gosh, you say the word data and I'm sort of bored to tears. We've heard that before in research. But we think it's really important that people can find out what's happening with patient data and can understand it. So that's kind of one of the reasons the programme was set up. The other reason as well is about really trying to listen to people's views and experiences and concerns around the way that their patient data or health data is used, trying to capture that and then take those views and those issues to policymakers to try and change the way that the system works. So that's another reason that kind of Understanding Patient Data was set up and is based at the Wellcome Trust, which is a global health foundation based in London. Okay,
so do you focus on any other research topic or is it primarily health issues?
The Wellcome Trust itself focuses primarily on health, but it has three key areas that it's focused on now. One is the impacts of climate change on health, the second one is infectious diseases. So, you know, things like the COVID pandemic has shown just how much of an impact they can have. And the third one is mental health. So the Wellcome Trust as a whole has those three kind of big topics, big global challenges that it's focusing on. But this project that we're talking about here is very much focused around, you know, the patient data angle, which actually can be crucial to all of those different topics and a whole load more as well.
Brilliant, very exciting stuff. So thank you very much for that, Grace. Rebecca, you are the Strategy and Engagement Manager for the Wellcome Trust, and your job title says it all, strategy, which is you know, making plans, and also engagement. So tell us a bit more about your role within the trust.
Yeah, sure. So again, like Grace, certainly in terms of the project that we're talking about here, my work is within the Understanding Patient Data programme specifically, within Wellcome, and really to sort of amplify and build on the points that both Kenny and Grace have made, and that as working in engagement and sort of strategic thinking around engagement, my goal is to ensure that the public voice, the public point of view, the public benefit and the public interest is really in the heart of those conversations about data, how data is collected, how it's used, the conversation that we're having with people about the importance of data, and exactly as Kenny said, to ensure that the conversations that we're having with people aren't tokenistic, but really sort of pulling from those sort of key insights that we then sort of plough back into our work with policymakers, our strategic thinking about what the important issues are, what the key concerns are that people have, and how we can kind of influence policy and practice to respond appropriately and in a really meaningful way to what people say to us in terms of their sort of questions and concerns about health data.
Okay, so in your previous work, has there been any policy changes as a part of your work?
So I would not be able to point to a sort of specific policy change myself, but what I would say is that I think it's within the sort of debate around health and health data, there's an increasing awareness that we need to have these conversations with people, and that their views matter, and that actually you can become very unstuck if you don't take account of people's views and their concerns and the questions that they might have. I mean, you know, a recent example, for instance, would be the GP data story, where there was a sort of big backlash against the changes that were being proposed, and that's had to be rethought, and it's now gone into abeyance as the policy is reconsidered. So I think there is a sort of a recognition at sort of government and policy level that you do have to take people's views into account, and that actually it's not only the right thing to do, but it's actually in the policy interest, if you like, because you do need to take people with you as you sort of try and sort of push through, you know, sort of key societal changes. And that as much as sort of Grace said earlier, you know, we might think that people think data's boring and dry, but actually they can get hugely animated by it if they feel that it's going to have repercussions for them. They can feel it very keenly. So I think through advocating for the public voice to be at the centre of these debates, and through you know, sort of significant stories like the backlash against the GP data change, that there is now a sort of recognition that actually it's really important to take people with you in these debates.
Okay, and what's the feedback or the response from the communities? Because obviously, you know, from a policy perspective, it's important to get the community involved. But in terms of the methodology of involvement, what kind of methods do you use in terms of getting people involved in that process?
Yeah. So, I mean, we can perhaps all sort of talk a little bit about this, but we're particularly keen, and this is why we began working with Kenny, with the qualitative conversations, in-depth conversations that you can have with sort of small groups of people to really sort of dig in deep into their opinions, the views, the questions they have, the concerns they have, the ambitions that they might have around their health data. And that complemented with really rigorous quantitative research can give a very sort of rounded and sort of rich picture of where public opinion is. But Kenny, do you want to talk more about the sort of methods that you would use?
And I think in terms of our partnership in relation to the project that we're working on now, I feel in terms of how we've gone about in approaching that, for me would be a great example. As part of the project, we created a co-creation group, which are part of. We made sure that we gave those people training as well, so they can actually fully participate. Because I think there's one thing to tell people get involved in research, it's another thing to train them to be capable in order to do that. And then at the same time, making sure that we give people the autonomy and the flexibility in order to gather insights and people's views and attitudes in a way that actually works for them. I guess for us, it's about appreciating that a lot of times research can be very rigid. However, but at the same time, as long as we can enable people to be able to have those conversations and be able to report back, and obviously we do the work that we need to do in order to present it and to share it back. However, I feel like working in partnership in that way allows us to ensure that we're getting insights that we otherwise wouldn't get, and that's why like we've really enjoyed working like yourself and others, because actually you're on the ground, you're in these communities day to day, and you're much closer, you're at the cold face of it all, whereas a lot of people, they can just be researching it, or we're looking at 20 different issues, whereas, so for us it's just about how can we gain that value, and I feel like the more you can involve people at the center in terms of what you're doing, the more rich and also the more nuances you're able to understand and look at. I think that's one of the biggest dangers of research, where you just get people making very wild and outlandish statements or findings where actually you kind of think, who did you speak to in order to get that? And if you're only talking to the people who are always geeked out to go and respond, then actually that's already biased. And as you know, there's a lot of people who, they have never ever been asked, what is your opinion? And for us, that's like the dream, to make sure that people are asked for once, what is your opinion?
So it's like asking in a way that people are comfortable to respond to you. It's not like a formal, structured process. It's like making informal for people to get involved. We talked about the project that you guys are currently working with, understanding patient data. Grace, how did that research project come about? And what was the need for that?
So the program itself, understanding patient data, that was identified. The kind of broader program was identified as an issue because health data or patient data, use lots of words for it, has got huge value, both in terms of improving our own individual care, the way that we're looked after by the NHS, and also in terms of using it for research, and also in terms of using it for planning. And so, you know, there's the kind of the individual level, but then there's also the level where if you pull together data from all of us into big data sets, then researchers, doctors, etc., can look at that data, try and spot patterns, and use it for really valuable research to do things like understanding the kind of risks and causes around diseases, kind of planning NHS services, improving patient safety, and also developing new treatments and drugs as well. And I think the COVID-19 pandemic has really shown the importance of using data for those kinds of things and the kind of the real impacts that can have. And so, you know, that happens. There's lots of safeguards to protect the data if it's going to be used in that way, but it's quite hard to find out how all of that works. It's quite hard to get up-to-date information, to understand that information. Often it's really jargony or very, written all in legal language. And so understanding patient data was set up to try and make all of that, the way that all works, a bit more accessible and try and find some interesting ways to do that. So one of the first things that the team did, which I was not here for, so I can't take credit for it, but they developed a whole set of animations that can be used in social media, in GP practices, on websites that try and explain the way that patient data is used. And I still occasionally get GPs emailing me saying, "Oh, can you send me those animations?" And it's all open. We made it for for colleagues within the NHS to use in their communications. And so that's just one example of a piece of work, but just to try and distill some of these topics and just make them a little bit more, relevant and understandable to people.
Brilliant. Thank you very much for all the information so far. After the break, we will be talking about the minority communities and their response to providing data. So we'll talk about that when we come back from the break.
BEONTV UK, for the community, by the community. www.beontvuk.com. BEONTV UK, for the community, by the community. www.beontvuk.com.
আপনি কি আপনার রেস্টুরেন্টের জন্য কমার্শিয়াল কুকার, তান্দুরি, হট প্লেট, ওভেন এবং ক্যানোপির বিশ্বস্ত প্রতিষ্ঠান খুঁজছেন? তাহলে আর ভাবনা নেই। সুদীর্ঘ 20 বৎসর স্পেন এবং ইতালিতে সুনামের সাথে ব্যবসা করার পর এখন বার্মিংহামে খোলা হলো আমাদের ফ্যাক্টরি। আপনার রেস্টুরেন্টের জন্য কমার্শিয়াল কুকার, তান্দুরি, হট প্লেট এবং ক্যানোপি আমরা গ্যারান্টি সহকারে তৈরি করে থাকি। Birmingham Commercial Cooker Limited. Phone 07952978136.
Lal Haweli Restaurant at the heart of Walsall. BBC Welsh Curry Award-winning chef Abul Hussain presents most unique and amazing tawa dishes with many flavours and choices. Eat with your family and friends. A unique dining experience never to be missed. Lal Haweli, a 400-seat capacity restaurant perfect for any small parties and functions. Special seating arrangements for ladies and families with prayer facility inside. Mouth-watering tawa dishes. Join Tawa Festival at Lal Haweli. Lal Haweli, home of Tawa. 1 Midland Road, Walsall.
BEONTV UK, for the community, by the community. www.beontvuk.com.
Welcome back to the Community Research Show. Today we are talking about understanding patients' data, and we have three guests here with us. We have Kenny from Clearview Limited, we have Grace from Wellcome Trust, and Rebecca from Wellcome Trust as well. We've been talking about patient data and about your organisations and the kind of work that you've been doing, wonderful work that you're doing to capture information from the communities on different topics, especially in areas of health and social care. What we want to touch on now is the minority communities. Obviously, generally the population responds to different kind of research program. How do you find the response from the minority communities, such as the Bangladeshi community and other communities, their response to providing data? Is there any kind of disparities in there, or any kind of gaps in receiving data from minority communities?
Yeah, well, we don't know at the moment. That's a really interesting thing, that we simply don't know enough about, on a sort of granular level, how different communities might react or have different views in different ways around issues to do with health data. There's an awful lot now of general population information and research about people's views and opinions on the use and collection of health data, but there's actually relatively little granular research that looks into the views and opinions of particular demographic groups, and that really is one of the main reasons why we wanted to carry out this research and why we wanted to work with Kenny at Clearview, in order to have those conversations and find out more. I think that, coupled with the fact that the sort of health disparities in terms of sort of outcomes that we saw from the COVID pandemic, for example, but also in other areas like maternal health and maternal mortality and all the rest of it, made us sort of particularly keen to speak to people from Black and South Asian backgrounds and to get a sort of greater understanding of their view on this area. So we're really keen to see what comes out of the research that Kenny's doing, and we'll also be doing some survey work as well to complement that, and hopefully at the end of this project we'll be in a much better position to to give a kind of more granular and more informed view on precisely the question that you've just asked.
Brilliant. And is this the research, is a nationwide research you're conducting, or is it region?
Yep, no, it's across the 4 nations of the UK, and likewise the survey will be too. And then we'll also be talking to healthcare professionals to get their perspective on this, to understand from their point of view how they feel about health collection and use as the people who are actually doing the collecting in sort of in various ways. What we do know is that there are gaps in the collection of ethnicity data, and we want to really find out from a range of perspectives, really, as to why that might be, what's going on, what's happening or what isn't happening, which means that data isn't being collected. And there's very much a sort of focus now for sort of better data collection off the back of the pandemic, and a recognition that we need really good data in order to sort of act appropriately and swiftly during health crises. But our feeling is that we can't hope to do that properly, to do that well, to really be able to sort of plug those gaps, unless we know what's happening on the ground and why this data isn't being sort of collected in the first place, really. So that is the sort of primary motivator behind this particular project.
Brilliant. So Kenny, I mean, obviously your organisation is leading on producing this research studies. What action are you taking so that this research is not biased?
That's a great question. So for us, obviously, we've kind of delivered this in two ways. So our team is also carrying out research, and we also have a group of community researchers that are doing the same. And a big part of that is to also make sure that we can validate our findings when we get to the end, in order to see have there been any similarities or any particular differences, and because actually there will be a lot of commonalities in between both strands of work. So that's one of the things we're doing. And then secondly as well, there's been a lot of work in our team around, this is not our first time doing this type of work with minority communities. We specialize a lot with working with people who are unheard in mainstream research, people with protected characteristics and ethnic minority groups. So therefore there's a lot of understanding in our team in terms of how you go about having those conversations, how you design the questions, and also around how you facilitate those conversations, because a lot of times they can be heated, and people can have various particular experiences, particularly when you talk about health as well, and what people, even if you're talking about data, the fact that it has to do with data and health, people have particular experiences where actually it can trigger certain things, and people can then feel the need to express. So I feel like there's been a lot that we've done in order to counter any particular biases, and actually this is why co-creation is important, because it's not just what one person thinks who writes the report, it's actually a group of people, and we're all saying actually this is what we believe it to be. So that's why working in that way, you're able to challenge that researcher bias in terms of actually this is what the community has to say, and not just we're just essentially, we try to see ourselves more as storytellers and actually engaging people in order to tell the story, as opposed to being the ones that say.
Well, one thing I like about your approach is that you're getting the community researchers involved in terms of identifying the questions that needs to be asked to the community. So that way, in advance, you're addressing the biasness, isn't it? Because you're getting the community to design the things that they can then take to the communities, because community researchers come from the community itself. So that's a really good approach, I think, and I think you'll get good quality research data. Grace, in terms of you're doing this program, the research studies, you're putting a lot of resources into that, a lot of manpower, organizations working together, and I know there's a lot of voluntary sector organization involved in terms of this piece of work, and I think it will eventually be a very good piece of work for that can be used. So from a policy perspective, what kind of changes do you envisage taking place as a result of this study?
So that's a hard question, because part of the answer, honestly, is it depends what we find.
Okay.
We don't want to jump ahead and say we think these are the things that need to happen.
Okay.
Because maybe when we hear back from the community researchers and from Kenny and the team, actually the things that we thought are not the right things. So in a way, we haven't got a sort of a clear cut, like this is what's going to happen next. I know that one piece of work that we are probably going to do is to design some resources for healthcare professionals, for people having these conversations, so that they can have kind of more informed conversations with people about health data, help them be responsive to people's questions or concerns, and sort of be really, help them be kind of open and honest and feel confident about that when they're asked. Rebecca, I don't know if you would add anything to what I've just said.
Yeah, I think that Grace is absolutely right, that in a way, rather than a sort of, a policy change, we're probably looking here at a kind of practice change in terms of how conversations are had and things are delivered on the ground. Exactly as Grace says, we don't want to sort of second guess the outcomes of the research, because the whole point of doing it is to sort of cast our opinions aside and actually find out from people themselves what's really going on here. But from our sort of early scoping conversations, it does seem to be that on the one hand, members of the public feel that conversations about data collection and use aren't being had with them, that this is not something that healthcare staff are talking to them about, and that for the healthcare staff, they feel that they don't have the sort of, some ways, the sort of the confidence or the skills or the know-how or the language or whatever to be able to have those conversations confidently. So there's a kind of, there's a bit of a vacuum there, and this is why we've come up with the sort of, tentative idea of possibly putting together some resources which we would create in collaboration with healthcare staff, but also with members of the public, so that it's something that sort of would really work for the people who are going to be delivering it, or part of the conversation. A kind of, I suppose, a sort of top tips or sort of guide as to how to have these conversations. That's what we're envisaging. But just to reiterate, it really does depend on what we hear, because we could be sent off in a completely different direction. We could have got completely the wrong end of the stick, and actually, you know, the answer's over here, not over there. So, you know, don't take this as read. It could all change within a few weeks when Kenny does the big reveal on the research.
And I think that's also one of the things that helps to challenge those, when you mentioned biases before, the fact that actually, even as we're carrying this out, and as you know, the whole purpose of this is not to look at how can we get more people to give data. It's actually to understand people's experiences, their views and their attitudes currently. So whereas you can have a lot of research where you're doing it in order to get people to do something as a result, whereas actually we just want to understand people, we don't actually want them to do anything with it. So it's a very different, and I feel like that the fact there's no agenda in that way, it really helps us to, well, it gives us the peace of mind. And also I think one of the things I know you talked about, like around data and everything else, this whole issue around trust and transparency is important. And so for us to have the transparency to be able to tell people, actually, we're not doing this in order to try and work you out so then we can work out how people can do it. It's actually, we just want to better understand this topic here and how can you help us do that? Which is very different to what a lot of people are used to. Yeah. A lot of people are wary.
It's a very bottom-up approach, isn't it? You know, you're putting the people at the forefront of the research itself, in terms of the aims and objectives, and also the results. So I think it's, for our viewers, it's also important to understand the difference between difference in data. So we have patient data, medical data, healthcare data. So Grace, tell us, give us a breakdown in terms of the differences in those data.
So I think, yeah, it's a really good question. It's not an easy question to answer, actually, because those terms you've just said actually often get used for the same things, or, you know, kind of swapped around. But I think the crucial thing is really that patient data can really mean kind of anything that's related to your health. So that could be kind of very specific bits of information from a medical record, but it could be something like, you know, your family history of having, you know, having a certain type of disease. It could be, it could even be to do with kind of whether you smoke. Like, there's lots of different kind of elements that could make up patient data. One thing that I do think is really important to mention is that often when stories hit the headlines about data, so when, you know, newspapers report on these issues, often the impression that you get from those stories and from the pictures even that they use is that when we're talking about, you know, health data being used for research, is that often it's a sort of a picture of a big file. And so the image you get is this idea that, you know, it's your whole, you know, that someone's seeing your whole medical record or your whole file, everything you've ever told the doctor is going to be used kind of in the research. That's usually not the case, actually. What often is happening is that it's actually kind of, well, first of all, the information specifically about you is often removed, and often we're talking about codes, letters and numbers that actually to me or you might not look like much, but for a researcher could be really valuable. And so I think it's just important to also stress that like when we talk about kind of patient data, the GP data that Rebecca mentioned earlier, and that NHS data that it can be used for research, we're not talking about people's sort of whole medical histories. We're talking about, kind of, you know, letters and numbers in a spreadsheet that don't kind of, you know, to us wouldn't immediately look like a person, if that makes sense.
Yeah, it does. Of course it does. And I think it's important for our audience to understand that, you know, when we talk about data sharing, it's not just about, you know, it's not about telling the story about your family, everything, telling the researchers everything about your personal life. It's coded, isn't it? It's taking information that is relevant for that research purpose. So we're going to have to go for a short break now, and then when we come back, we will talk about how the community can get involved in terms of more community research. So we'll look at that when we come back, and we'll also talk about the impact of COVID and how important it is for our communities to share their information so that we get correct information about the situation that we're in terms of the pandemic in moving forward. So yeah, we'll come back. Join us when we come back. Thank you. Yes.
BEONTV UK, for the community, by the community. www.beontvuk.com. BEONTV UK, for the community, by the community. www.beontvuk.com.
অন্যায়, অত্যাচার, অবিচার, রাজনীতি, অর্থনীতি, সংস্কৃতি, ধর্মনীতি কিংবা দুর্নীতি, প্রাসঙ্গিক হয় নিয়মের জালে যা অপ্রাসঙ্গিক, যা আপনি বলতে চান, আপনারা বলতে চান, এসবেরই সমসাময়িক প্রেক্ষাপট নিয়ে আপনাদের সরাসরি অংশগ্রহণে আমি রিয়াদ আহাদ বিয়ন্ড টিভির পর্দায় আসছি নতুন অনুষ্ঠান নিয়ে। আমিও বলতে চাই, আপনারা বলবেন, আমরা শুনবো।
রিয়াদ আহাদের সঞ্চালনায় কমিউনিটির নানা বিষয় নিয়ে ভিন্ন মাত্রার অনুষ্ঠান আমিও বলতে চাই দেখুন প্রতি সপ্তাহে শুধুমাত্র বিয়ন্ড টিভিতে। প্রযোজনায় শিপন আহমেদ।
BEONTV UK, for the community, by the community.
আপনি কি আপনার রেস্টুরেন্টের জন্য কমার্শিয়াল কুকার, তান্দুরি, হট প্লেট, ওভেন এবং ক্যানোপির বিশ্বস্ত প্রতিষ্ঠান খুঁজছেন? তাহলে আর ভাবনা নেই। সুদীর্ঘ 20 বৎসর স্পেন এবং ইতালিতে সুনামের সাথে ব্যবসা করার পর এখন বার্মিংহামে খোলা হলো আমাদের ফ্যাক্টরি। আপনার রেস্টুরেন্টের জন্য কমার্শিয়াল কুকার, তান্দুরি, হট প্লেট এবং ক্যানোপি আমরা গ্যারান্টি সহকারে তৈরি করে থাকি। Birmingham Commercial Cooker Limited. Phone 07952978136.
BEONTV UK, for the community, by the community. www.beontvuk.com.
Welcome back to our community research program. Today we are talking about understanding patient data, and we spoke about the importance of collecting data to deal with some of the problems that we have within our communities. And we have three guests with us here today: from Kenny from Clearview Limited, Grace from Wellcome Trust, and Rebecca from Wellcome Trust as well. Thank you guys so far for the interesting conversation about data collection and so forth. What I want to touch on now is the importance of data in regards to the fight against COVID-19. So what do you think? Has the data that we have within our midst, has that been enough to find solutions to the COVID-19 issues, or do you think the communities needs to be more proactive?
I guess I'm going to let you speak because I just want to make one quick point. I think there's one of the points is to do something which Rebecca said earlier, just around first and foremost looking at how we ask people questions in the first place and making sure that people can actually be identifiable when gathering data on them. Because obviously now, one of the biggest issues is that you just see a whole block that says, I don't know, BME, ethnic minority, and actually there's a lot of distinct groups and people there. And when you, for example, you say Black African, for example, do you mean is that Nigeria, is that Zimbabwe, is that like where are you, and I feel there's a lot of that data that's actually missing. And so I think the whole whole COVID-19 situation has also raised awareness in terms of the importance of making sure that actually we get way more granular data on people to better understand which communities are affected. When you say BME, is that someone Asian? Is that someone who is Polish? You don't actually really know and the back. So that's one of the things which I feel what the pandemic has raised awareness about. And then also I would say there's that whole thing around people have a natural skepticism around data, around the numbers, and I would actually say it's okay to want to challenge in terms of when you see stuff. However, I think this whole situation has also brought about this whole topic of fake news as well, which I think then makes the whole topic around data more challenging, because the question is what data you're seeing depends on what news you're looking at. And I guess I just wanted to throw that in there just because I think like it's very important for people to be alive to the fact there are people who their agenda is just to spread misinformation and just to spread fake numbers. And so I feel like actually there's way more we can do to ensure that how do people know when a source is reliable or not, particularly because I know we're talking a lot about community, but WhatsApp itself has been a massive hub for misinformation. I'm sure you've had all types of messages sent to you in terms of around COVID and what is going on. So this is why I feel like in this context, even having this conversation around data becomes scary, because then a lot of people are not trusting in general for valid reasons as well. And the reason why I mention that is because sometimes people feel like people's sense of not being trusting of particular things means that they're skeptical or they're trying to disengage, but actually people can have a fair reason for not wanting to engage or to believe particular things, because for a long time until COVID, actually for a lot of communities they weren't really engaged in a particular way, and all of a sudden, this is where the data thing, which I find this whole thing interesting, is that even if people actually genuinely believe, okay, they've had this data all the time and they knew this and they knew that we were more at risk of this and that, why did nothing happen? And I think sometimes the issue is not just about how is my data used and in what way do I want it to be used, but actually more transparency in terms of what good comes from this. And I feel like that's actually probably a bigger conversation. Even with what we got now, what can we currently do in order to improve the lives of people who are already sharing that? But I just thought that was just important to mention as well. But I'll pass it to Rebecca. Sorry.
Yeah, no, that's absolutely right, Kenny. And I think you know, one of the points that you were making there at the beginning was, you know, this isn't just a numbers game. This isn't just about sort of more data, but it's about sort of really good quality data. And you know, you sort of talked there about sort of ethnicity categories and really ensuring that they're sort of granular and that people can kind of sort of see themselves in the list that they're presented with and sort of feel, you know, that it kind of matches their experience and their reality. And I think, you know, that's incredibly important, and you can absolutely see why, you know, over time it'd be incredibly alienating if you were sort of being confronted with a list that just didn't speak to you in that way. So it's not just about sort of the quantity of data, but it is also about the quality. I mean, of course, you know, it's sort of hugely important when you're faced with a pandemic, for example. You know, the data will help you to sort of track the spread of the disease. It will help you to develop sort of treatments and vaccines to combat it. It will enable you to sort of highlight particular groups that are affected particularly badly and to be able to sort of target support appropriately and all the rest of it. And at Understanding Patient Data, you know, whether it's in relation to the pandemic or anything else, you know, we sort of pride ourselves on sort of putting out there really great, clear, balanced resources which sort of explain you know, what data can do, but equally we would sort of defend to the hilt you know, people's right, if they sort of still feel uncomfortable, if they're still not convinced, to be able to sort of opt out of having their data used. And you know, from our website you can find sort of information on the opt out and so on, and we just think that's really important for it to be there, for people to have the option to opt out. And actually that in itself, we hope, strengthens the system and makes the system a more sort of trustworthy one for the public.
So in terms of the confidence level of the communities, what can So when an individual decides to take part in a research, what can give them the confidence to take part? Because it could be a misinformation exercise, but how can people feel confident in a piece of research that it is genuine? Does that make sense? Yeah. So, what things people need to look into before they take part in a kind of research studies?
Yes, I think it's always important. So I guess there's certain things people can do. So one of the things which we always tend to do is more times than not reveal who's actually funding the research first and foremost. So obviously we're doing this work around data, of course, and we've made it very clear that understanding patient data are funding us to do this research. So being very transparent on that, because then if you don't trust the organization that's funding it, then you may not want to get involved in the research in the first place. And one of the things I mentioned to before, being very clear on what does your participation look like and what would that involve, and also making it very clear in terms of looking at what are they going to do with your data. So with us, we make it very clear what we're going to use and how we're going to process it in English, and very simple English, just so it's kind of back to what Grace talked about before, where people just use jargon so they can just then, so it's like what the tech companies, a lot of people do, they just have these long things that no one reads and we will press accept to, but actually you don't know that you've told them. You can now look at your telephone numbers, you can look at this, but yeah, so with us it's about being very clear on what data we're going to use and why, and also even when we're asking, people asking you for particular information that may not seem to be something you'd probably ask when doing that, also feeling comfortable to question why are you asking for that particular piece of information. So for example, and we've seen it, we may do a study and we've asked for people's financial income. However, some people might think, actually, that's just very nosy. Why do you need to, I'm not applying for a loan, this is not a mortgage, this is not anything to do with finance. But however, we make it very clear to explain, actually, we ask because maybe if people earn above this, we wouldn't want them to take part because they actually really want to talk to people. So I think there just needs to be way more on actually research organizations to make very clear, even when they ask the question, don't take it as a given, to explain why are you asking that question, and as a participant, feel comfortable to question and say, I don't want to answer that, or why are you asking me that? But these are some of the, I think, simple things that people could do.
So you need to empower yourself in terms of when you participate. It's not just about straightforward answering, but you have to make a judgment whether that question that you've been asked, whether it's it's a genuine question, isn't it? And it's also whether it's relevant to the topic of the studies as well. So, okay. So I think one of the things I want to do, I mean, it's very interesting the kind of work that you guys are doing, like from your organisation. Is that something that you always? Is there any other projects that you are involving communities in your within your organisation, or is there any future projects that's going to come where you would like communities to take part?
Yeah, no, so we 100%, so always looking for people from all over the UK to take part in a lot of the research that we're doing. Yeah, every other week we're pushing out opportunities for people to get involved, whether in interviews, group discussions, or doing stuff at home. And we're very much pride ourselves in making that easy for people, so they don't have data, we're happy to buy them data. If they need particular help with technology, we're happy to provide that, and just wherever it is. So for us, it's just to make sure that everyone has an equal opportunity of being involved. So even if we've had cases where people get involved and, for example, they're maybe hard of hearing or wherever it may be, and we're able to provide the mechanisms to make sure they can contribute. I mean, for me, and even for us at Clearview, it's just very important that everybody has that equality of opportunity to actually get involved in this, that no one should be left behind. It shouldn't just be left to people who are tech savvy, and particularly now when a lot of people, and this is why I'm glad that things are beginning to open up, because actually it's important that we also are in these communities ourselves as well, because I think that's another problem where I think with this reliance on technology, also a lot of people now can't be involved because nobody wants to be on Zoom and everybody wants to.
The question I would ask then, I mean, if anybody wants to become a community researcher, what do they need to do?
So they could email us, go on our website, they can just sign up. And we're going to create a platform soon, which will be launching in a couple of months, where people will be able to sign up and look at the different topics that we're doing and be able to pick which one they would want to be involved in. But for now, people can follow us on social media, and they can also go on our website and register their interest.
Okay, brilliant. So going back to the Understanding Patient Data study, when is the finding coming out? Soon.
Well, yeah, the sort of this particular tranche of work will be in about a month to 2 months' time, sort of around the end of February. But as I mentioned earlier, we're also doing a survey, and we're also doing some work with healthcare staff as well, with a view to potentially creating these resources if we find that that's what people are after, and that will take a few more months. So you know, that will definitely be wrapping up by the end of this year, but it'll take a few more months, because we want to ensure that we do it really thoroughly, and we are properly co-creating it with people who we hope will then go out there and use it. So we want to do a sort of a really thorough job of it. So this has been a really important stage, but there are a couple of other stages.
Brilliant. And in terms of from the Wellcome Trust, I'm sure you've been involved with other research projects, and if our audience wants to find out, or if there, if there's another reports, how can they access those reports that you've already have?
I say again, the website and social media is the place to go. Yeah. So yeah, welcome.org. It's welcome with 2 L's, just to be really confusing. So yeah.
That's right. Brilliant. Brilliant. So it's been really interesting to talk about these issues, and I think it's for our community it's very important, because there's it's important to critically at this time. It's important that we as a community work together and then express the issues or problems that we have through proper channels, through studies. So it's very important that our community is getting involved in this kind of community research program. So thank you all very much for coming and talking to us and talking to our audience about your projects, and we would like to welcome you back again. Once you have your research a report published, come and share with us and with our audience as well. So I would like to thank you once again on behalf of BEONTV and the community for coming and sharing your insight with us. So thank you again for joining us, and please go to their respective websites to find out more about the current program, and also there's plenty of other research programs out there, and I think it will be better for our knowledge and education as well to find out what's been going on in the past, and also if there's any other future research projects that you can get involved, because as a community researcher there's loads of doors will open for you, because as a community researcher you can build a lot of skills in terms of project management, project delivery. So you as a community researcher will be able to develop your skills for better employment opportunities as well. So do look into the Clearview Limited website, and also Wellcome Trust website as well.
Can I also say, actually, do also check out understandingpatientdata.org. That website has much more information specifically about this programme, and if people have questions about the way that their health data is used, have a look there. Have a look at the NHS website as well. There's a section called Your Data Matters. Have a look on that section, and that will give you lots of information as well about the way the system works. I just wanted to mention that too.
Brilliant, thank you very much. So that was your final words then. So, so Kenny, your final word.
Please go into clearviewresearch.co.uk and just sign up, or click chat to us, wherever you want to click on, and you'll be able to get through to us. And I've really enjoyed it, so thank you very much for having me.
You're welcome. Thank you. Rebecca, final words?
Just that likewise, I've really enjoyed it too, and having these conversations are absolutely the heart of our work, and talking to people directly and really having an in-depth discussion about their thoughts is key to what we do. So thanks for the opportunity.
Thank you. Thank you again to our people at home. Please share this talk show with your friends and colleagues, and we look forward to seeing you in the near future as well with another topic. Thank you very much for joining us.
BEONTV UK for the community by the community. www.beontvuk.com. BEONTV UK for the community by the community. www.beontvuk.com.
আপনি কি আপনার রেস্টুরেন্টের জন্য কমার্শিয়াল কুকার, তান্দুরি, হট প্লেট, ওভেন এবং ক্যানোপির বিশ্বস্ত প্রতিষ্ঠান খুঁজছেন? তাহলে আর ভাবনা নেই। সুদীর্ঘ 20 বৎসর স্পেন এবং ইতালিতে সুনামের সাথে ব্যবসা করার পর এখন বার্মিংহামে খোলা হলো আমাদের ফ্যাক্টরি। আপনার রেস্টুরেন্টের জন্য কমার্শিয়াল কুকার, তান্দুরি, হট প্লেট এবং ক্যানোপি আমরা গ্যারান্টি সহকারে তৈরি করে থাকি। Birmingham Commercial Cooker Limited. Phone 07952978136.
BEONTV UK for the community by the community. www